Let's continue then with our module on the shoulder anatomy zone. We are in position 1. We have already previously evaluated the biceps, and in position 1, we have also assessed the scapular floor. Now let's look at the coracoacromial ligament. Pattern identification. So we start from an anatomical drawing. Coracoid, acromion, and remember the shape of each of these anatomical segments, and the histological pattern which we saw in the basics. So if we know where our ligament starts and ends, and we remember our twisted histological pattern, which is not as well organized as the fibular pattern of tendons in the longitudinal view, in this case we can find it in position 1. We already know what this drawing refers to, and so we have already previously evaluated the biceps and the subscapularis. Let's place our probe starting from where we were, having finished the short axis evaluation of the subscapularis. So in that same position, which, as we said, corresponds to the long axis of the biceps. Just a play on words. But don't get confused. Basically, the long axis of the biceps is as we're drawing it here, and the subscapularis would be oriented in this direction. So the short axis of the subscapularis would actually be the long axis of the biceps, starting from there. From there, we move to the coracoid process to look for the characteristic acoustic shadow in other images. And we're going to turn toward the coracoid, from the coracoid to the acromion, and we're going to look for that twisted conical pattern, just like we see in this drawing. So starting from our coracoid, we're going to identify a pattern of very hyperechoic images, almost as bright as a tendon. But in this case, as we showed in the previous drawing, they're conical and more twisted. This allows us to identify it, and it would be more or less like this. The drawing shows a conical image with a fibrillar pattern, very well organized, but not as much as the twisted tendon and the other structures we've already learned to identify, like the muscles and so on. Let's look at it again in a larger drawing. So, in that position. After having evaluated the subscapular biceps, we move on to the coracoid, rotating our transducer about 30 to 45 degrees. We look for our structure using the sound reading technique we've already learned to identify bone structures and between the two. So the structure we want to find in this case. So we reach the coracoid, evaluate it, rotate our probe toward the acromion, and you'll see that we find a clearly identifiable structure with a well-defined pattern, bone structure against bone structure, that is connected. Remember that ligaments are named for where they go from and to, in this case, coracoacromial. The coracoacromial ligament, underneath it, as we saw before, is the subscapularis and the footprint. But what's important here is the position. At first, it's a bit tricky, but it's actually very, very simple. Basically, if you learn to identify this, you'll also be able to identify the position for interventions and for proper diagnoses. In the rotator interval or rotator interval,